So, hello there. Did you know that every 30 seconds, a person dies from viral hepatitis? And more than 350 million people in the world live with viral hepatitis. And out of these, 9 in 10 people are unaware of their condition. My name is Maura Moroki, and whereas I'm not infected with hepatitis, I am affected by it. As a note, I am not a medical specialist. I am merely an advocate here to enlighten people on hepatitis, because I think it is important to know and understand the condition so as to either prevent it or deal with it if infected by it. Now, to begin with, there are 5 types of hepatitis. They are in alphabetical order: A, B, C, D, and E. The most recoverable of which are A and E with supportive care. However, hepatitis B, C, and D are often the most dangerous, because what then happens is that without early detection, they can lead to chronic illnesses such as liver cancer and liver cirrhosis, a condition of which is a lifetime condition, which can only be managed by certain supportive drugs such as ARVs, similar to those that are taken by HIV patients. Additionally, it is worth noting that of the 5 types of hepatitis, B is 10 times more infectious than the HIV virus. What am I essentially saying? If you come into contact with any bodily fluids of a person with hepatitis B virus, the virus stays active for several hours even after in the bodily fluid of the infected person, even after it has left the body, unlike HIV, which only survives for a few minutes at most. Hepatitis A and E are commonly transmitted through unsafe water, drinking water, which you can contact anywhere, contaminated food, and poor sanitation, whereas B and D are mostly transmitted either through sexual or bodily fluid contact from an infected person. It is worth noting that bodily fluids include blood, which can come about through maybe sharing of objects, things to do with mother to child, unborn child, during pregnancy, blood transfusions, tattoos, and even just mere contact with, the infected substance, including saliva. As such, it is really important to note that anyone can be infected with this virus. However, the good news is that there are preventative measures that are in place that can prevent you from acquiring the more deadly types of hepatitis, that is B and D. So for starters, there are vaccinations, particularly with hepatitis B, which are readily available in any public hospital and which last for several months to perhaps a year or two once injected. Additionally, regular screening of blood is necessary, especially by medical personnel, to prevent contamination of people with blood that it may be infected, may be contaminated with the hepatitis virus. Additionally, it is important for personal responsibility to take place in personal hygiene. Do not share any personal hygiene items such as razor blades, things to do with piercings, and even when you are acquiring services like tattoo services, ensure that the items being used are properly sterilized, because once infected, the problem with this disease is that it carries a very huge stigma, in addition to the health complications that it brings to a person, which leads to a lifetime of concern. Additionally, you will find that highly populated spaces such as prisons are common grounds for infection, as well as people who commonly practice indiscriminate sex, such as sex workers, as well as persons of, who practice same-sex relations, that is the homosexuals and lesbians. As such, it is really important that persons who are sexually active and perhaps engage in indiscriminate sex to actually ensure that they protect themselves by ensuring that they use the proper protective equipment and are vaccinated from hepatitis. Additionally, it is important that you keep healthy, eat healthy, ensure that you have meals that comprise of 50% vegetables, 25% animal and plant protein, as well as 24% carbohydrates. A balanced diet, basically. Essentially, this helps to prepare yourself in the event of infection of any kind of hepatitis virus to at least have a standing chance against this disease. Additionally, water is very crucial, and clean and sterilized water is key. So ensure that you take at least very good care of yourself health-wise. For those of us who do a bit of a tipple, it is important to have responsible alcohol use. Ensure that whenever you're using alcohol, at least ensure that it is not prolonged and it is used responsibly. This is because it has been scientifically proven that persons who have alcoholic, who actually use alcohol regularly and excessively, are at risk of alcoholic fatty liver diseases, medications, and and as such, they are more susceptible to the virus if infected, because already the virus, once it gets into the body, it finds an already weak liver, and so the damage is immense and quick. Persons who use certain herbal medicines and remedies for certain infections, as well as persons who are infected with the HIV virus, are also highly susceptible to the virus and infection, further infection with hepatitis. So it is really important to ensure that you have a very clean understanding of your health and your body. Whenever you have any concerns with how you feel, go to a medical professional. Ensure that you're tested, ensure that you're checked out, because early prevention may just be, in fact, what you need to prevent early death. Thank you for watching, and I hope you are informed. Bye-bye.